Brown. I'm Erica. I am a student at USC Upstate, and I'm going to do a nursing comprehensive assessment on you.
Yes, ma'am.
What would you prefer that I call you?
Trey.
All right. Hi, Trey. Nice to meet you.
Same to you.
All right. So the first thing we did is vital signs and a hearing test and a vision screen. His vision screen on the vision chart was 20/20, and his hearing test was appropriate. Vital signs were all within normal limits. Assessing him, just visually looking at him, appearance, he's clean and well kept. There's no funky odors coming from him. He's being appropriate for the situation. He makes eye contact, he's friendly, and he's being cooperative with the exam. So Trey, the first thing I'm going to do is just kind of test your mentation and orientation. So tell me what your full name is.
Anthony David Brown III.
And what's the date today?
February 26, 2021.
And tell me where you are right now.
I'm at home in Columbia, South Carolina.
All right. And for memory, can you tell me like the events of today? What'd you do today?
I woke up this morning and went to work, and I got off at 1 o'clock. Came home and got here around 1:30 and went to the gym around 2:30 and worked out. Got back and did some schoolwork, and now I have a doctor's visit.
Okay. All right. So next we're going to do just a basic skin assessment. So looking at him, his skin looks okay. There's no obvious lesions anywhere. We'll look at his legs. Perfect. All right. I'm going to touch you, okay?
Mm-hmm.
All right. So feeling his skin, it's warm and dry. His skin turgor is elastic. His cap refill is good. Same with his legs. Skin is good. The hair is appropriate. There's no bald spots. There's no noticeable lesions. Cap refill is good on his feet as well. You can relax your legs. Next, I'm going to feel your pulses, okay?
Mm-hmm.
So brachial pulses are 2+. They're equal. You can just relax. Radial pulses are equal as well. Just relax. Popliteal are equal, about 2+. Dorsalis pedis are both equal, 2+. And posterior tibial are both equal, 2+. There's no edema, there's no venous ulcers noticeable anywhere. Nails, look, they're clean, they're not thick. He's got fingernails on every extremity, toes included, toenails, and they're all clean. So the next thing I'm going to do is check your lymph nodes. All right, so I'm going to touch you again, okay? So we're just palpating your pre-auricle, your post-auricle, occipital, tonsillar, submandibular, submental. All right, lean in towards me. Turn your head towards me a little bit. There you go. Deep cervical. Turn your head the other way. All right, shrug your shoulders up. Supraclavicular. And then hold your arms out. And axillary. Any tenderness or pain when I palpate any of those places?
No, ma'am.
Okay, great. All right, so next is our head and neck assessment. Looking at his face, his features are symmetrical. There's no lesions anywhere. His eyes look clear. There's no drainage. There's no drainage from his nose. There's no drainage from his ears. I'm gonna just look at your eyes, so just kind of look past me. All right, we've got Pearl. There's no drainage in his nose. If I could, have you close one nostril, breathe in and out. And the other side. All right, great. Stick your tongue out for me. All right. Hard palate and soft palate look good. Say ah.
Ah.
Tonsils look good. There's no exudate on them. There's no redness noted anywhere. Lift your tongue up. Buccal area looks good. There's no lesions. All right, close your mouth and smile. Gums look good, they're nice and pink, teeth are intact. Dental health looks good, and he's got braces. Alright, so next I'm going to palpate your sinuses, okay? There's no bogginess noted. Any tenderness in either of those areas?
Nope.
Alright, good. Alright, we're going to kind of go on, then do like a cranial nerve assessment, okay? So I'm going to have you do your eyebrows, lift your eyebrows, smile, stick your tongue out, move it side to side. Say ah for me one more time. Alright. Shrug your shoulders. Excellent. And that was cranial nerves 2, 3, 4, 6, 5, 7, 10, and 11. Alright, so next I'm going to listen to your heart and your lungs. So I'm going to listen to your heart first. So just breathe normal, okay? Alright, so we start on the left side. We're listening to the aortic valve first. We hear S1 and S2. And then we move over to the same area on the left side and listen for pulmonic valve. S1 and S2. And then move down a little bit to Erb's point. S1 and S2. One more time for tricuspid valve. And then last place is mitral valve. This is also where we listen for apical pulse. And Trey's pulse is only about 65, so. And then we'll go back and we'll listen to each area with the bell in order to hear for any murmurs. And there are no noted murmurs. All right, so next I'm going to listen to your lungs. You'll take some big deep breaths when I get with each time, okay? All right, big deep breath in. Try to take them slower. There you go. All right, now I'm going to listen through your back, okay? So same thing, just big deep breaths. I'm gonna go and just touch all back here, okay? Any pain or tenderness that you notice anywhere?
Nope.
All right, how about up front?
Nope.
Okay, I'm gonna lift your shirt so I can look at your spine, okay? While I'm back here. All right, so I do notice on his skin there is some acne scars, but he's already taking clindamycin foam for that, so that's an expected finding for him. We knew about that. His spine is midline. Any tenderness on your spine?
Nope.
And no curvatures are noted. All right, and I'm gonna go ahead and listen to your belly, okay? Lay back without hitting my curves. All right, so I'm just gonna listen. And you just listen until we hear vowel sounds. And he's got Very good vowel sounds in all quadrants. One second, I'm gonna do palpation on your neck. So just lean back again for me. All right, so I'm gonna touch your belly. Just try to relax. Any pain anywhere, tenderness?
No.
All right, and then on a skin exam for his abdomen, there's no lesions, there's no venous areas around his abdomen to indicate like cirrhosis or anything like that. It's flat, looks good, okay. All right, and then we'll do musculoskeletal, so we're just gonna kind of check out your joints. So if you would stand up for me. The first thing you can do is just kind of roll your shoulders, do your elbows, wrists and fingers. All right, same thing, hips.
What are the hips?
Yeah, lift them up and there you go. Any pain doing any of that? Knees,
No.
ankles and toes. All right, and you can sit down for me, hold your arms out. All right, I'm gonna try to push down, don't let me push him down. And now I'm going to push you up. Don't let me push up. All right, same thing for your legs. Push them down. Great. All right. Strength is good, equal and bilateral on both sides. There's no pain in any of his joints. How about your neck? So say no, say yes. Any pain there? We did knees, toes, we did spine. Oh, the last thing I'm going to do is try to palpate your thyroid gland. This might be a little uncomfortable, but we find your little thyroid cartilage here, and then we palpate on both sides. And I think you're supposed to swallow. Try to swallow. I can't palpate anything, but that doesn't mean there's nothing there. I don't think we should be able to palpate anything, but that's not an easy one to do. And I think that's it. Thank you very much.